Well, heart surgery is prevalent today because there are a lot of people who apparently, according to the cardiologists, will qualify for it. But I think you really sort of have to get in a little bit into the science of this disease to understand how easily it can be disrupted and it can be put on the back burner. I think all experts in this disease would agree that where cardiovascular disease has its inception is when we progressively destroy the capacity of our life jacket and our guardian, which is the innermost layer of the artery. Has a name, the endothelium, E-N-D-O-T-H-E-L-I-U-M, the endothelium. And the endothelium manufactures an absolutely magic molecule of gas, nitric oxide, that protects all of our vascular structures. What are the functions of nitric oxide? It keeps all the cellular elements within our bloodstream flowing smoothly like Teflon. They don't get sticky. Number two, nitric oxide is the strongest vasodilator in the body. When you climb stairs, the arteries to your heart, the arteries to your legs, they widen, they dilate, nitric oxide. Number three, nitric oxide protects the wall of the artery from becoming thickened, stiff, or inflamed. Protects you from high blood pressure, hypertension. Number four, an adequate, safe amount of nitric oxide protects you from ever developing blockages or plaque. So literally, everybody on the planet with cardiovascular disease has so trashed, has so injured, has so compromised the capacity of their endothelial cells to make nitric oxide, they don't have enough to protect themselves. And it's pretty well known now, what are the foods that every time they pass your lips, you decimate and you injure and you destroy the endothelial capacity to make nitric oxide? They are oil, olive oil, corn oil, soybean oil, safflower oil, sunflower, coconut oil, palm oil, oil in a cracker, oil in bread, oil in a salad dressing. Oil injures endothelial cells, as does anything with a mother or a face. Meat, fish, chicken, fowl, turkey, right? Animal protein. And anything that is dairy, milk, cream, butter, cheese, ice cream, yogurt. And I'm a bit of a fuss budget when it comes to anything that's too much sugar, maple syrup, molasses, and honey. And I don't like, for my patients with heart disease, I don't like them to have coffee with caffeine. Coffee with decaf, okay. Interesting enough, tea with caffeine, okay, but not coffee with caffeine. Now, what are you going to eat? You're going to eat all these marvelous whole grains for your cereal, bread, and pasta, 101 different types of beans and legumes, and all these marvelous red, yellow, and green leafy vegetables and some fruit. Now, in the last 5 years, especially for the patients who have cardiovascular disease, I should mention that we have a little addendum that I'm guilty of. So it's a little bit of a taskmaster, but I'm told I'm not as mean as I look. And that is, when you think about it, if you could get your head inside that artery, you would see that that plaque and that whole constellation of inflammation is an absolute cauldron of oxidative inflammation. So we need antioxidants, okay? No, do not go down to the health food store and buy a jug of pills that says antioxidant. Not only will that not work, but it could be harmful. We want you to get your antioxidants from food, all right? What food? Food that is high in what we call ORAC value, oxygen radical absorptive capacity. So if you are having raspberries, blueberries, and strawberries on your cereal, wonderful. But nothing can trump the antioxidant value of green leafy vegetables. And so I need, if you are a cardiovascular disease patient, for these first 2 years that I'm seeing you, I need 6 times a day. I want you to chew, not a smoothie, never juicing. I want you to chew a green leafy vegetable the size of your fist after it has been boiled in water 5.5 to 6 minutes or steamed till it's nice and tender. Then you must anoint it with a number of drops of a delightful balsamic vinegar. Why? Because it's been shown clearly that the acetic acid in that vinegar has a remarkable capacity to restore what we call nitric oxide synthase, which is the enzyme within the endothelial cell that makes nitric oxide. So I want you to chew that alongside your breakfast cereal. I want it again as a mid-morning snack. I want it again with your luncheon sandwich. And of course, a mid-afternoon snack. And yes, at dinner time. And God, I adore it when you have that evening snack of kale. What are you doing? All day long, you're absolutely bathing and basking that oxidative cauldron of inflammation with nature's most powerful antioxidants. And when we started that, we began to really see how rapidly, especially the patients with chest pain and angina, would begin to get rid of it. And it was really, it's a powerful adjunct. I don't think that after a couple of years, they'd have to still do it. I was asked this at a national meeting. Dr. Esselstyn, after 1 year, do you suppose I could reduce that number? And I said, yeah, I'm flexible. After 1 year, you can cut it down to 5. So, but it's very easy for the patients, once they see how powerful it was and how effective it is, that they'll want to keep it going. And we just published another paper, actually last July of 2014, on some 198 patients that we had been following for close to 4 years. One of the things that was most fascinating about this review of these 198 patients was that among the 177 who were compliant, close to 90% who were compliant with our nutritional guidelines, what we found was that in the follow-up of 3.75 years, there was something of the order of 99.4%. That is, one patient had a major cardiovascular event, a stroke, a mild one in China, and that's the event that occurred. Now, I'm sure if we did that again with another 200, there'll be some events. That's inevitable. But what is so powerful about it is when you compare those results to the standard cardiovascular results at 4 years, which are usually somewhere right around 20 or 21 or 22% who will either have died or had a heart attack or had a stroke. We're down at 0.6%, if you count that. So the difference is many-fold. And guess what? It's not a drug. And guess what? There's no horrible side effect. You're just eating food, right? So it doesn't cost us. So you've got something with no additional cost, food, no side effects, all right? Well, that's not true. You will lose weight. You will lose your high blood pressure. You will lose your diabetes. You will feel better. You'll lose your risk for stroke. You'll lose your risk for dementia. You'll lose your erectile dysfunction, if you're a man. So there are side effects.